We started as branding, advertising, event management company back in October 1990. As our graphic department grew, then we added a division of signage design and installation in 1995. That was like another value-added services to our clients who intended to keep their branding identity throughout. With all this experience collected, we took another leap to interior design services for corporate offices by incorporating their branding identity into their premises. This transformation was quite easy, seamless, since I was from an architecture background. I would say the unshakable faith our existing client had with us helped us to flourish easily.
We started off workspaces, hospitality interiors, retail and commercial spaces, and public and educational institution interiors. One of the greatest experience we had was when we were involved in industrial workspace international company called Aerospace Composite Manufacturing. It is actually a US-based company but located in Kedah. This company manufactures composite structure for all commercial Boeing aircraft. So transforming each spaces in this factory exposed us to international codes and compliances, color, materials, requirements, and the MNC culture of environment. At this point in 2016, we are already starting to look for something more fulfilling, more rewarding. In that sense, we realized that our satisfaction were mainly in human-centered design. So we wanted to fulfill human core needs and incorporating them into interior space planning to ensure optimum user experience, effortless interactions, and ultimately benefit business.
Another factor that attracted repeated clientele was the way we combined colors, graphics, signs, branding identity into their interiors. Thus, our work was gaining recognition quite rapidly.
With human-centered design in mind, we were looking for bigger challenges. That's how we were drawn into creating healing environment for healthcare industry. This gave us a divine satisfaction that we feel that we are giving back to the society, and we felt that while we are shaping the healthcare environment for the better with God-gifted talent.
We went on fact-finding mission by researching and studying local and international designers and how a healing environment been designed by them. We got engrossed with the way aspects like air quality, thermal comfort, noise reduction, privacy, views of nature, aspects of serenity, visual stimulation, access to nature, positive diversion, and access to social support, and options and choices within the set of bylaws, elimination of environmental stress. All this is taken into consideration when it comes to creating an environment that are therapeutic. Oh my, that is a quite bit to grasp and apply into design works. Would one want to go into the trouble when there is an easy way out? And I said, oops, we did it. And that put us into a niche. We took this as a challenge, aimed to change the current trend, whereby the most hospital setting adopt caregiver centrist instead of being patient centrist. So we wanted to create bespoke private hospital interiors with next generation healthcare concepts with a benchmark of international standards in fulfilling the codes and compliances of the interior planning and finishes. Yes, that is what we intended.
All that being said and done, it's actually a bit of a challenge, especially when we are facing project owners. who start to feel that such transformation is unnecessary, is just too expensive. So they opt for traditional or conventional interiors. Convincing everybody in this industry about emerging global trends where healthcare interiors are heading towards seems to be a bigger challenge indeed.
As we went on creating interiors with functional, sustainable, safe, calming, and healing factors, and at the same time striking a balance between aesthetics, ambience, emotions, efficiency, and try to exceed expectation of users' experience. That was what we are trying to do. We are totally against the idea that ambience can only be created with expensive materials and massive budget. It can be done with moderate budget, with attractive graphic elements on the wall, via glass panel manifestations, uniquely selected furnitures, custom designed fixtures, and choosing soothing colors for finishes. It can already do the job.
We have mastered the art of interior signage. Both interior and exterior of signage are actually the major component in creating a safe environment, stress-free environment, and ease circulation and wayfinding.
We have formed a consortium with a team of various professionals who are our panel consultants right now to become turnkey contractors for healthcare facilities. Our experience, combined with our panel of consultants, totals up to 30 years of healthcare experience.
We form partnership with our clients so that we can offer them solution as solution provider rather than just a supplier or contractor. We begin to see that patients are supposed to fight only disease and not the environment. For those greater reasons, we decided to carry a slogan such as building smarter healthcare with better interiors.
Healthcare are not just hospital and clinics these days. There are other emerging trends of wellness center, women and children center, aged care homes, and confinement homes. We plan to earn our name in this industry by moving up the ladder, not just be ID designers, but to be ID contractors as well as ID consultants at the same time. Then, eventually, we work our way towards turnkey project management with our team of interdisciplinary panel of consultants. We are poised to become the most sought after healthcare facility builders team.
We are looking at serving Southeast Asian countries such as Myanmar, Vietnam, Cambodia, Thailand, Brunei, Indonesia by 2026. We have also lined up our CSR program as well as charity program within this healthcare industry. So before year 2030, we aim to be one of the Malaysia's public listed companies.